COVID-19 has led to a bevy of access issues for people with disabilities. When we talk about accessing treatment, only 10% of the 40 million Americans we said that have substance use disorders access treatment over the past year. When asked why, almost a quarter of people said they didn't know where to go. And over a fifth of individuals said that they weren't going to treatment because they didn't have insurance and they couldn't afford it. Treatment access was even lower, again, for people who identified as Black or Hispanic. Unfortunately, due to funding issues, some local substance use programs had reduced funding during the pandemic. Some treatment centers, due to social distancing limitations, were forced to limit their patient capacity. So there were long wait lists and people couldn't get into treatment facilities that they needed. Other treatment facilities closed altogether because of financial issues related to the pandemic. To make matters worse, there was a lack of access to physical wellness activities. So people weren't able to manage their physical conditions as well, to exercise, to access food that might be nutritional, that will help them in overall wellness, which led to exacerbation of mental health issues, exacerbation of substance use issues, and exacerbation of physical issues, which all exacerbate one another. And individuals with disabilities who are at high risk for severe illness, they became more isolated. They weren't able to go out in public and access certain things due to fear and real risk of infection. As I mentioned before, many of the very, very necessary peer support programs that help people with accountability as they're working their recovery treatment programs, their 12-step programs, they were temporarily unavailable. Many of them eventually started offering remote meetings. However, there are some downsides to remote treatment and peer support, right? So telehealth became an option. Virtual peer support became an option. But for some people, it was a less effective option, right? They reported that being face-to-face helped with accountability, helped with relationships, helped with their social isolation issues. And while virtual peer support was better than nothing, it wasn't the same as being able to attend the meetings like they used to. And as far as telehealth, that's great. But if you are somebody who needs medically assisted treatment or opioid replacement therapy, so you're someone who takes methadone or buprenorphine to help with your opioid use disorder, you have to go into the doctor to get that. And so many prescribers were temporarily able to give longer prescriptions, up to a month supply to their patients. But there was very, very much increased access issues to MAT, or medically assisted treatment, and opioid replacement therapy. And that was especially true for Black and Hispanic Americans. Talking about mental health, numerous studies specifically showed that there was an increase in depressive symptoms, anxiety symptoms, and trauma symptoms across the board during the pandemic. This was especially true for Americans who were considered essential workers. There's been numerous studies on those considered essential workers that showed they had higher rates of substance use, higher rates of suicidal thoughts, and higher rates of mental health issues. There's also been a substantial increase in mental health symptoms among individuals who identify with the LGBTQ+ community. So again, people in already disadvantaged populations experiencing even more stress, mental health complications during the pandemic. Sometimes this is directly due to COVID-19. Sometimes it was indirectly due to COVID-19. Some people had increased stress that exacerbated their pre-existing conditions. Some people might have experienced direct trauma as a result of COVID-19. So maybe they themselves had COVID-19 and were put on a respirator and had a traumatic experience, felt like they almost lost their life, or maybe that happened to a loved one, or maybe they had a loved one who lost their life during COVID-19 so far. That can be very traumatic. Job loss and financial stress is another factor that's led to mental health concerns during COVID-19. I mentioned social isolation already. Lack of access to physical and psychological wellness treatments and tools. I mentioned not being able to go to the gym, to go exercise, or to find tools and classes or whatever it might be that the person relied on previously to be physically and psychologically well. Unfortunately, it was also estimated that there was around a 20% increase in intimate partner violence worldwide, which has a direct negative impact on mental health and well-being. One study showed that as many as 13% of Americans reported they either started or increased substance use as a way of coping with stress or their emotions related to COVID-19. So we've established that there are a complex set of factors that have caused COVID-19, substance use disorder, and disability condition to impact one another. And that we really are in a time that we need to find solutions to treatment and service delivery needs for people in our communities that are dealing with substance use disorder, that have been impacted by COVID-19 pandemic, both directly and indirectly, and who are also living with potentially other disabling conditions as well. So what we've done in our presentation is we've put together some recommendations for treatment and service delivery. But I would suggest that this is an ongoing conversation, that we need to find solutions. And certainly this presentation will not have all the solutions, or maybe even a small amount of the solutions that we need to be able to find. But hopefully we're asking the right questions and we're heading the right direction. So I would love to share with you some of the thoughts that we've put together on how we can at least start heading in the right direction for improving treatment and service delivery for individuals that have been impacted by these three separate but co-occurring phenomena. First, I've mentioned how critically important work is. One thing we want to emphasize here is that people dealing with substance use disorder, disability, and COVID-19 absolutely must be able to access vocational services. Unemployment can have significant negative consequences for their substance use, for their other medical or psychological condition. And so we need to continue to increase the interface of vocational rehabilitation services for individuals with substance use disorders. which is already relatively low. People with substance use disorder don't know about these services and don't access them really frequently. I would suggest that we need even more VR professionals than we already have who specialize in substance use disorders. I know that some state federal VR programs have begun to move this direction, to have counselors who are specializing in substance use. I would suggest that we need to continue to interface more with drug court, diversion programs, residential facilities, and treatment facilities. Raising awareness that these services exist and that people with substance use disorders qualify to benefit from these services. I would also suggest that just like we have specialized caseloads for certain VR counselors for certain conditions, that we need to continue to have specialized caseloads for individuals that we've trained in substance use disorders. There have been many studies showing support for evidence-based approaches to vocational services like supported employment, individual placement and support, or the SEIPS model. Yet, due to systemic constraints in the state federal VR system, we really can't do SEIPS as it's meant to be done. So how can we bridge that gap and use more of these principles effectively in our VR practice? Also, are we training our VR counselors in motivational interviewing, which is a very important evidence-based practice for working with individuals with substance use disorders? So I would suggest that we need to continue to emphasize training opportunities for professionals in this field so they can utilize those evidence-based approaches when working with individuals with substance use disorder. I also would suggest that we continue to do what we call demand side VR. So working with businesses and employers, educating them on the benefits of hiring and retaining employees in recovery, making sure they understand that whether they want to deal with it or not, this is a national issue and they probably have employees that are struggling with this. And it will benefit them both from a overall well-being standpoint and from an economic standpoint to have the right policies in place to destigmatize and provide treatment options to employees with substance use disorders. I would also suggest that it's time to strike while the iron is hot. Many businesses right now are desperate for good workers, for employees. I've heard in some of the conversations I've had with local businesses that they are now willing to give more opportunities to people that maybe they weren't willing to hire before because of the desperate need for employees. And so for people with substance use disorders, now is as good a time as ever to try to get into the workforce. So how do we take advantage of the demand for employees and show that people with substance use disorders can be good employees, people in recovery can be successful in that process? I also would suggest that we need to have a strong focus on adversely impacted populations. If there's one thing that is very clear from the research on COVID-19 and the issues that have come with it, is that not everyone has been affected equally. People in lower socioeconomic statuses are communities of color in the United States, and people who identify in the LGBTQ plus community have all been adversely impacted by COVID-19, financial loss, and substance use disorders. So how do we generate research funding, and services and direct them toward individuals in these different communities? And how do we make sure that we're training professionals and enabling, empowering professionals in these communities themselves to help determine the policies, to help run the programs and design the programs? Americans with disabilities have seen some of the highest unemployment rates. They've seen increased social isolation, which is already, before the pandemic, a problem for Americans with disabilities. And they've seen an increase in physical access issues since the pandemic. So how are we focusing on improving access to treatment and services for individuals with disabilities in the United States, which was already not something we were doing great at? How do we provide safe, accessible treatment options? How can we focus on community inclusion opportunities in the midst of the pandemic for people with disabilities? And how can we encourage access to vocational services like the state federal VR programs? Next, how do we utilize remote treatment and support in a meaningful and effective way? For some people, it is the best option currently, and it's not without its disadvantages, as I've already talked about. So how do we maximize the effectiveness of these treatments? And how do we hopefully make it a long-term positive for people, maybe in rural populations or urban populations who had trouble accessing treatment before, but with the onset of telehealth, might actually have increased access due to that? So how do we maximize the effectiveness and minimize the issues that come along with it? We most certainly need to encourage people to find providers who utilize telehealth treatment when they're needed or desired, but who also utilize evidence-based practices within their treatment protocols. One such suggestion from the American Psychological Association was seeking out treatment providers who provide cognitive behavioral therapy, or CBT, with contingency management. In other words, I might not be seeing you in person, but we can go through and do CBT, and I can also provide contingency management, i.e. gift cards and other financial incentives for people to stay clean, to remain abstinent from substance use. Make sure that we are continuing to train and utilize motivational interviewing and evidence-based practice. It's especially helpful in times where people feel very apathetic and demotivated. And the community reinforcement approach and community reinforcement and family training, or CRAFT, CRA and CRAFT, which is a very effective treatment approach for individuals with substance use disorder, but also for their families. And in a time where domestic or intimate partner violence is at an all-time high, and substance use is a piece of that, we need to make sure that family members of people with substance use disorders have access to treatment too. And they have education and training to know how to deal with those situations. I think it's really important is those of you that are professionals in the field, those of us that are professionals in the field, that we keep a resource list available, broadly speaking, but specifically of virtual support groups. AA meetings, NA meetings, other peer support groups that have gone virtual, and virtual community support groups that people with substance use disorders, people with disabilities, people that are experiencing issues due to COVID-19 can seek out. And again, I think we need to be mindful of the drawbacks that this type of treatment and support can have. That although it's nice to be able to do a virtual group, there's still a lot of value to be able to be in person. But there's still risks to that for people that are at high risk for severe illness. So again, it's really a case-by-case basis. There's a lot that needs to be unpacked there. I would suggest that we need to do a better job of education and health promotion. How do we encourage the use of coping skills to deal with the psychosocial stressors that come along with COVID-19 in a time where people don't have access to all the coping skills that they used to have access to? There's a resource here at the end that I will give you a link to here in a few slides that suggests different coping skills that might be particularly important for mental health issues during the pandemic that I found to be very helpful. It may be important to assist your consumers in creating a wellness plan, emphasizing the need for accessing mental health treatment when applicable, with the caveat that mental health treatment has been very difficult to access, and for some people, they can't afford it. So helping people maybe get health insurance issues sorted out. And that goes back to getting a job, maybe helping people get employment so they have health insurance so they can access affordable mental health treatment. And you see how, again, all of these issues really feed off of one another. It can be a negative feedback loop that impacts people negatively over time, or with the right services and the right assistance, it can be a positive feedback loop where people get healthier and healthier, right? They're able to get into recovery, and then they're able to eat better and exercise more, which helps their physical condition, right? And improves their overall mental health well-being, which improves their mental health conditions, and they get access to the doctors that they need to get the medication and treatment that they need. So it's important to emphasize the importance of physical activity and nutritional health, especially since those have been particular issues that have been raised during the pandemic: access to physical activities, access to grocery stores, to restaurants, to food. It's important to be aware as a professional, if you're working with individuals, of mental health and suicide risk and warning signs, especially due to the increased incidence of mental health issues and suicide, particularly among disadvantaged populations, essential workers, individuals, Americans who identify as Black or Hispanic, individuals who identify with the LGBTQ plus community. And it's important to encourage consistent support networks. People who have been isolated have lost a lot of their support networks. People have been creatively trying to find virtual ways to continue those. You know, I've heard of people playing cards on Zoom or just video, or just having drinks with friends over video. Whatever you can do to stay connected and to stay supported, finding ways to do that is extremely important. Lastly, I would suggest that we need to continue to advocate for harm reduction measures. So while ideally people with substance use disorder can get into recovery, we know that that's not necessarily going to be the reality for everybody. So how do we advocate for increased harm reduction measures to make sure that the people that are using are safe, so we can decrease the number of overdose deaths that are happening due to substance use? As I mentioned earlier, we need increased advocacy for access to opioid replacement therapy, or what's also called MAT, or medically assisted therapy. This is especially important for people of color who have reported decreased access during the pandemic to these services. And then here are some safety tips specifically from SAMHSA, that are really important for harm reduction, especially during the pandemic. Because a lot of people are using drugs alone, the dangers of overdose is even higher because nobody's there to administer Narcan or to call emergency services if someone overdoses. So it's recommended that people tell friends or family members when or where they're going to be using and ask them to check in on them at specific times if possible. There are overdose prevention smartphone apps that can ensure help if somebody needs it. I would suggest they utilize those applications that are widely. It's important just as much as ever to make sure people avoid sharing drug equipment. Unfortunately, when drugs are prepared by their people, they can be mixed unequally, especially if they're laced with things like fentanyl or carfentanil. So you never know if you're going to be taking drugs that is loaded up with fentanyl or carfentanil or has none of it. And for people, unfortunately, they might get something in the drug mix if it's not prepared, if it's prepared by somebody else that they don't know what's in there, and that could lead to overdose and ultimately death, unfortunately. So trying to avoid drugs that are prepared by other people, minimizing close contact with other people when getting and using drugs. So maintaining social distancing, wearing masks if possible. Utilizing services provided by syringe service programs if available locally for them. And lastly, some of these programs have made mail order access to sterile supplies possible. So making sure that the individuals you're working with are aware of mail order access supplies if it's available to them. So as I mentioned, I wanted to share some recovery resources with you. The first link here is SAMHSA's virtual recovery resources. So access to virtual resources, including support groups and treatment options for individuals. The National Institute of Mental Health put out a very helpful guide for coping with COVID-19 and the stressors that are related to COVID-19. For individuals in distress during this time of natural disaster, and COVID-19 absolutely fits the description of what is a natural disaster. There is a SAMHSA helpline for people with substance use, mental health, suicidality issues. So I would ask that you have that on hand and make individuals you're working with aware of that if they need the assistance. And lastly, I have links to the CDC and the National Institute on Drug Abuse, or NIDA, here, that has additional resources and education programs available. So in review of our learning objectives during our presentation, we've discussed substance use disorder in the United States and how it's currently a public health crisis. We've talked about how individuals with disability are more likely to experience substance use related issues. We've discussed how COVID-19 has had a substantial negative impact on overall health and quality of life for people with substance use disorders and other comorbid health conditions. And we've talked about how we can increase access to treatment and resources along with strong advocacy, especially for adversely impacted populations, and how critical that is. Again, we don't have all the answers. We know that this is a serious problem, that these are multiple problems that are occurring separately but affecting one another. And we know that we need to find and come up with solutions fast. And so hopefully this is a conversation starter. And for those of you in the field, hopefully this gives you some ideas. But I think that this is, again, just that. It's step one in a very long multi-step process of us trying to come up with solutions to combat this issue and to increase access to services and treatment for people during this time. I want to thank you so much for your attention before we open it up for our Q&A. Again, my name is Michael Leslie. If any of you want to reach out to me, I'd love to hear from you. My email is mleslie8@kent.edu. That's MLESLIE, the number 8 at KENT.edu.
Dr. Leslie, we do have a question, and the question comes from one of our attendees. The question comes from Lisa. The question is, telehealth has helped us reach many more people, but there are still too many that are in areas without adequate bandwidth.
Yes. Yeah.
Maybe your research can be tied into a grant to bring bandwidth to some of those areas.
Yeah, thank you for bringing that to my attention,
Yeah.
Lisa. Thank you for bringing that to everybody's attention. I actually meant to put that as I was developing this presentation, that thought was in the back of my mind. As somebody who grew up in a very rural area with limited kind of cell phone access and internet access. I'm from Southeast Ohio, right on the border of West Virginia. I definitely have seen those type of things, and in working with Appalachian populations, I see people talk about limitations. You know, it's the same population that really need to be reached by telehealth because they have to drive 30, 45, 50 minutes sometimes to get to a treatment facility that telehealth can assist. Like you said, you can reach so many more people. Those are the same people with lack of internet access, right? Or people with lower socioeconomic status that can't afford these things are the same people that are having trouble with access to telehealth. So yeah, your point is so well taken, and we need more grants, and that's something that maybe I can, or even people, you know, that are attending today, hopefully we all can find ways to do our part to advocate for that, right? Because it's, you know, internet access is becoming more and more of a needed utility across the board. And especially for treatment. You're so right. Thank you for bringing that point up. Thanks, Lisa.
That appears to be the only question we have so far, Dr. Leslie. If I did put in the chat, if anyone would like to ask a question or have a comment, please put it in our Q&A box. And
yeah, we'd love to have comments and feedback. If anybody has comments and feedback for us, what did we miss? You know, what did we not talk about, or what maybe did we get wrong? Is there anything that you're seeing in your practice, or you're seeing that is maybe different than what the research is saying or what we're seeing? You know, I'd love to hear from all of you.
Yeah, we do not have any questions in the Q&A box or comments in the chat. So
I'm happy to stick around for a minute if anybody comes up with any.
Okay. As advertised, this has been terrific. It's been an honor and a privilege for Dr. Leslie to join us today. I want to thank him for his informative and timely presentation. And thank Dr. Leslie for taking time out of his day on a Friday here to share his experiences and expertise with us. So thank you, Dr. Leslie. And,
looks like we got something in the Q&A there. I don't know if it's a comment or a question.
It doesn't.
Oh, okay. Yep. That's okay.
I'd like to thank all of our attendees for joining us today on this Friday afternoon, and be well and stay safe.
Thank you all so much. Take care.